The confirmed number of coronavirus cases in Los Angeles County comes to 408,396. The confirmed number of deaths reaches 7,700. Here in Torrance, the total number of confirmed cases is 2,102, with total confirmed deaths remaining at 77. Welcome to COVID-19 Today. I'm Rhiannon Trutanich. It's 4 p.m. on Tuesday, December 1st. LA County hit another grim milestone, passing more than 400,000 COVID-19 cases to date. And our daily case number is at 5,150, far more than what was recorded during the pandemic's first peak, which took place mid-July, when it was less than 3,000 cases. Currently, there are 2,185 people hospitalized with COVID-19, 24% of them in the intensive care unit. This is twice the average seen just a couple of weeks ago. Public health officials are concerned that the increasing numbers in hospitalizations could overwhelm the healthcare system, especially as we approach Christmas. They are closely tracking the number of positive cases among healthcare workers related to the COVID-19 pandemic response. They reported an additional 747 new cases this week. Public Health Director Dr. Barbara Ferrer says we are at the most difficult time in the pandemic, and it's very possible that the daily number of people hospitalized could reach around 2,500 within a week. She urges those who traveled or gathered around the holidays to quarantine for 14 days. California's public health leaders are asking hospitals across the state to test their healthcare workers at least once a week. They're also asking hospital staff to test all new patients before admitting them. The state reported more than 7,700 confirmed coronavirus hospitalizations on Monday, with more than 1,800 of them in ICUs. Statewide, 75% of ICU beds are filled, and officials expect to reach capacity by mid-December. The California Department of Public Health sent hospitals a letter last week strongly recommending that they test employees once a week. These workers are defined as those who are both paid and unpaid and have potential for direct and indirect exposure to patients. They include doctors, nurses, students, and volunteers. The California Nurses Association announced that this is a tremendous victory for the type of infection control measures they've been demanding since the beginning of the pandemic. They say there are too many asymptomatic people with COVID-19, and without robust testing, hospitals will remain centers for spreading the disease instead of centers for healing, as they should be. Meanwhile, the California Hospital Association notes that hospitals don't have the testing capability to meet the request of the Public Health Department. California has 500,000 hospital workers, and 250,000 of them would have to get tested weekly, which would burn through the available supplies during a time when we are about to see more COVID-19 patients than ever before. Organizations disagreed about whether or not this letter from the state is a recommendation or a requirement. The Public Health Department says hospitals are required to submit a testing plan, and the state recommends that plan include weekly testing of healthcare workers. Governor Gavin Newsom is considering another round of stay-at-home orders similar to what we saw earlier this year. On Monday, he said he could mandate stricter guidelines for purple-tier counties if COVID-19 cases continue to go up. California is experiencing the highest rate of coronavirus cases since the start of the pandemic. 51 of the state's 58 counties are currently in the most restrictive tier, which means the vast majority of its population could fall under another lockdown. Governor Newsom did not outline the details of the potential new order, but if it's similar to the one from March, people would have to stay indoors at all hours except for essential services and exercise. He also says while numbers are rising in California, the state is doing better than the overwhelming majority of other states. He shared that we rank 39 in the 7-day average case per 100,000 in the country. Governor Newsom also provided important updates regarding the state's COVID-19 vaccination plan. He said the state is set to receive 327,000 doses of a vaccine this month. He added that transparency, equity, and safety will continue to be the top priorities as we begin the distribution process for Phase 1. The first massive air shipment of the vaccine from pharmaceutical company Pfizer arrived in Chicago on Friday. It's currently being stored at a facility in Kalamazoo, Michigan. The drug maker says its vaccine was 95% effective in a trial and awaits the green light from the Food and Drug Administration to start broad distribution. Pfizer submitted its application for emergency clearance on November 20th, and the FDA is expected to publicly discuss it on December 10th. Meanwhile, an advisory panel for the Centers for Disease Control and Prevention is meeting today to discuss how to recommend who gets the vaccine first once it's approved by the FDA. Some people can get their shots as early as before Christmas, but with only 20 million doses available this year, prioritization is key. Health officials previously said seniors with underlying health conditions and doctors treating COVID-19 patients should receive the vaccine first. Whatever the advisory board decides will be non-binding, meaning state and local officials will ultimately decide how to distribute the doses. The nation's top infectious disease expert, Dr. Anthony Fauci, says all high-priority individuals are expected to get the vaccine by April of next year. The goal is to get most Americans vaccinated by summer. A new study shows that COVID-19 was here in the U.S. weeks before health officials previously thought. It also reveals that the coronavirus made its way to our country before cases in China were publicly identified. The new government study published in the journal called Clinical Infectious Diseases sheds light on U.S. infections that occurred prior to the first officially confirmed case in January 2020. The virus and the illness that it causes were first identified in Wuhan, China in December of 2019, but it wasn't until January 20th when U.S. reported its first case through a traveler who was returning from China. The authors from the study say that the coronavirus infections may have been present in the U.S. in December of 2019. Researchers came to this conclusion after the CDC analyzed blood donations collected by the American Red Cross from residents in 9 states, including California. They found evidence of coronavirus antibodies in 106 of the more than 7,300 blood donations that were collected between December 13th and January 17th. The presence of antibodies meant that the person was exposed to the coronavirus and their body's immune response triggered their body's immune system triggered a defensive response. Researchers added that despite the findings, widespread community transmission in the U.S. likely did not happen until late February. They say this report will help broaden health officials' understanding of the pandemic and help identify what resources and public health interventions are needed to stop serious illnesses and deaths from COVID-19. Another study reveals that COVID-19 is hitting some nursing homes harder than others. Skilled nursing facilities with the highest number of Latino residents had coronavirus case rates 57% greater than those with few Latino residents. And facilities where more than 2% of residents were Black saw case rates as much as 40% higher than those without a significant number of Black patients. A nonprofit called California Healthcare Foundation released a study today examining data from May and August. It doesn't include a reason for the disparities, but a factor could be that more Black and Latino people live in lower quality facilities that are less equipped to deal with an infectious disease such as COVID-19. The largest proportion of positive cases among healthcare workers in LA County throughout the pandemic has come from those working in skilled nursing facilities. So far, they make up almost 1/3 of all healthcare worker cases. The county's public health department is working with these facilities to make sure they are as safe as possible. Small businesses in California will soon see some tax relief and $500 million in aid. The tax measures include a 3-month automatic extension of the incoming tax payment deadline for those that pay less than $1 million in sales tax. They also expand on a program that allows businesses with up to $5 million in sales to reach agreements on interest-free tax payments. Similar interest-free payment options will also be offered to larger businesses. The additional $500 million in relief funds will be available to small businesses and nonprofits. They will be offered in grant amounts of up to $25,000. Many small businesses have been struggling during this pandemic. A survey by the Small Business Majority in August found that 44% of them are at risk of shutting down. And data released through the Census Current Population Survey show that minority-owned businesses are disproportionately impacted. The number of active businesses owned by African Americans dropped by 41%, Latinx by 32%, Asians by 25%, and immigrants by 36%. California's 4.1 million small businesses employ 7.2 million workers, which is almost half of all private sector employees. They create 2/3 of new jobs in the state. A new review of national test data looks into the pandemic's impact on online learning and finds that kids are generally unaffected. It shows that the new learning style for the majority of children in the U.S. has had little impact on their reading growth and slightly slowed down their math progress. A testing nonprofit called NWEA covers close to 4.4 million students in 3rd to 8th grades. It's data coming from a check-in assessment called the MAP Growth Test. It measures a kid's math and reading skills and is generally given 3 times a year. Millions of students who took these tests reveals that on average, they're performing similar to pre-pandemic times in reading. But in math, the students performed up to 10 percentile points lower than the pre-pandemic comparison group, which is considered a moderate drop. Still, the overall analysis shows that students are continuing to learn despite school shifting online. They just didn't learn quite as much in math as they would have if they continued going to in-person classes. While the report is overall positive, the data may not be as accurate as we'd like because it doesn't include many of the nation's most vulnerable students. Researchers noticed that about a quarter of students who previously took this assessment a year ago were missing. These students are more likely to be from high-poverty schools and more likely to have lower performances. Researchers believe these students didn't take the latest test due to a lack of technology or access to the internet at home. Still, they say this assessment offers the clearest picture on how the past 8 months have affected student learning on a wide scale. Uber announced today that it completed its acquisition of food delivery service Postmates. The all-stock deal is valued at around $2.65 billion. Postmates will continue to operate as a separate service with its own branding, but operations such as a shared pool of drivers will merge. In a statement titled "Stronger Together," Uber shared that the company experienced challenges, including a massive shift of focus and resources towards delivery. It stated that this move would benefit the merchants that they work with. The company also announced a new initiative to encourage and gather customer feedback on the merchant side, saying it'll work harder to understand their needs. Uber hopes this effort will give restaurants and other businesses a bigger seat at the table to provide feedback on products in development, policy decisions, and more. The city of Torrance is launching Takeout Tuesdays starting today. Mayor Patrick Fury says with COVID-19 rates on the rise, it's important to help local restaurants survive through the recent LA County public health orders. You can take a look at a long list of Torrance-based restaurants that offer takeout at cityoftorranceca.com/Torrance Takeout. The city also encourages shoppers to support other local businesses during this holiday season. Many of them created new ways to engage with their customers, from direct online ordering to curbside delivery. Mayor Fury says shopping in Torrance not only helps businesses who have been hit hard by the pandemic this year, but it also means we're keeping money local to support our own community. All month long, Starbucks is offering free coffee to frontline workers. The company says they're providing this perk to those who are keeping our community safe during COVID-19. Any customer who identifies as a frontline responder will receive a tall brewed coffee, hot or iced, at no charge. This offer is valid for doctors, nurses, public health workers, pharmacists, and many others who work around the clock to protect and serve our communities. Starbucks also donated $100,000 to the National Alliance on Mental Health to support virtual mental health resources for frontline workers. It also plans to surprise 50,000 of them with care packages and gift cards this holiday season. Starbucks has given away more than 2 million cups of coffee and 300,000 care packages and letters to frontline responders since the pandemic began. The Torrance City Council meets tonight to conduct city business. The public portion of the meeting begins promptly at 7 p.m. Among the agenda items are a couple of resolutions honoring city employees who are retiring after decades of service. And the city council members will also consider the appeal of a potential single-family residence development on the 22,000 block of Wormside Avenue near Palos Verdes Boulevard between Prospect Avenue and Sepulveda Boulevard. You can tune into the meeting tonight live starting at 7 p.m. There are many ways to watch it on air and online. Well, before we go, at the end of each program, we like to share stories from our community, feel-good pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. A 6-year-old boy named Damien is helping sick babies at Torrance Memorial Hospital in a very special way. With the help of his mom, Tricia, Damien pledged to donate $1,000 to the hospital's neonatal intensive care unit. It's his way of providing assistance to those who need it in a safe and socially distant way. Tricia is a nonprofit development director and says it's important to teach our children at an early age to understand the importance of philanthropy. Damien pledges to donate $250 for the next 4 years to meet his $1,000 goal. He even created his own version of a handwritten check, complete with a race car, because he believes race cars make everyone feel better. Tricia hopes Damien's thoughtfulness can inspire others to give generously to the little babies in the NICU on this Giving Tuesday. What a great way to give back to those who could really use the encouragement, especially during the holidays. Now, if you have a great story to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 today. Be sure to tune in tomorrow as Christine Lee brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.
Greetings, I'm Alan Petker, Artistic Director of the Los Cancioneros Master Chorale. You know what we need more than anything else this coming holiday season? A concert with a choir, an orchestra, and outstanding soloists. And that's exactly what we will deliver on December 13 at 4 p.m. Pacific Standard Time. I am pleased to announce the Los Cancioneros Master Chorale Holiday Concert, We Need a Little Christmas, with featured guest artist Aaron Blake. This will be a virtual concert that we are taping in the next few weeks. Besides internationally recognized tenor Aaron Blake, we will also include some of our own solo artists, select archive performance clips from previous holiday concerts, an interview with renowned composer Sean Kirchner, and much more. To watch the premiere on December 13 at 4 p.m., visit our website, lcmasterchorale.com. Although the concert is free, the Los Cancioneros Master Chorale would appreciate your support with a donation of $25 or more. Please don't miss it. It will be wonderful and great for the holiday season.